Endometriosis is a condition that affects 10 to 15% of women during their reproductive years. More than 90 million women globally suffer from the condition during their lifetime. TGMC will explain what endometriosis is and how to best treat this diagnosis.
All right, joining us now is Dr. John Floyd. Haven't seen you in a while. Welcome back. Good to see you.
Great. Thank you. Appreciate being here.
All right. It's been a while since we got to talk, but endometriosis, first of all, simply, what is it?
Endometriosis is a gynecologic condition that we see quite commonly. It's a condition where the endometrial cells that resemble the cells that line the internal lining of the uterus transplant themselves to other organs of the body, and most of the time cause severe pain and problems for a woman, and may interfere with their reproductive lifestyle, interfere with having future children, cause infertility.
Okay. What organs are typically involved with endometriosis?
Endometriosis, the most common organ, is it transplants itself to the ovary. We typically, at laparoscopy, see it on the posterior portion of the ovary. It may transplant itself into the lower pelvis. Less commonly, we see it along the lining of the intestine, the lower colon, the small intestine. It may even sometimes transplant to incisions, especially if a woman's had a previous cesarean section or previous abdominal surgery for some reason.
Okay, let's take a look. We're going to put a list on the screen for our viewers, and there are some common symptoms that go along with this. So if you could take us through them and please explain in detail what they are.
The most common symptom that women present to us complaining of that makes you think of endometriosis is painful periods. The periods may be heavy, but their main complaint is the pain. That's also known as dysmenorrhea. Typically, the pain will start a day or two prior to their period and continue throughout their menstrual cycle. The next most common that they complain of is pain with intercourse. That it typically can cause significant relationship problems. It can be so severe that they're unable to even have intercourse. Third, problems with bowel movements or urination. If the endometriosis transplants to the intestine or to the posterior portion of the bladder, they'll have problems along these lines. Also, sometimes even just plain excessive heavy menstrual cycles will cause problems. Some women, however, having no symptoms will present with infertility, and during the workup you may determine that they have moderate or even significant endometriosis. So sometimes the degree of illness is not necessarily related to the degree of symptoms. Also, other symptoms, just as typical PMS type symptoms, problems with diarrhea, problems with just not feeling well, problems with lifestyle, they bloat, they get nauseated, the life's just not going well for them. And this usually occurs either right before the menstrual cycle or during the menstrual cycle.
All right, good time to ask you this. What causes endometriosis?
Nobody really knows what causes endometriosis. Endometriosis is thought to be caused by retrograde menstruation, and that may account for the large majority of it, where basically when a woman has her menstrual cycle, the blood flow not only goes out through the outflow tract, but it may reverse and go back up through the fallopian tubes and end up in the lower pelvis, and this may implant itself and then become endometriosis.
All right, let's hold that thought. We got a few more questions for the good doc. We're going to take a break here from Terrebonne General Medical Center, and when we come back, we have more with Dr. John Floyd. Don't go away.
We take these souped up four-wheelers and we put them in mud 3 to 6 feet deep. It's a thrill, it's an adrenaline rush. My name is Marie L. Howard, and I went from stage 4 cancer to completely healthy in 7 months. Mary Bird Perkins helped me find my cure for cancer. They knew what they had to do to save my life so that I could raise my son, and every day I get to do that is a miracle. I still believe in superheroes because what they did for me at Mary Bird Perkins was nothing short of superhuman.
Mary Bird Perkins Cancer Center at TGMC.
Put together a crew of top specialists, and you can do amazing things. cardiac care at TGMC. It all begins here.
My PhD is in chemistry, so I've spent a lot of time doing research in the lab. I work for Albemarle Corporation. My name is Arcelio Malcolm, and I was treated for prostate cancer at Mary Bird Perkins. I went to Houston for a second opinion, and they recommended the same treatment plan, so I chose to be near my family and have the treatment done here. When you research the technology and the doctors, you see that Mary Bird Perkins is a perfect choice.
Mary Bird Perkins Cancer Center at TGMC.
All right, welcome back. Dr. John Floyd, our guest. Endometriosis is the topic. And the risk factors of endometriosis, what would they be? We're going to show them on the screen, and you can explain them.
The most common risk factors are a family history of endometriosis or never having had a child. Women who have heavy menstrual cycles or short menstrual cycles that come more frequently than every 27, 28 days tend to have a greater risk of endometriosis. Also, women who may have a blockage of their outflow tract, some sort of cervical disease or cervical blockage that causes more backflow of the blood to cause the endometriosis.
Okay. The complications when you have endometriosis, are there any other complications that come with it?
Yeah, the main thing we worry about with endometriosis is all these women are in the reproductive age group, and most of them are interested in having children, that you see a greater risk of infertility. Probably 30 to 50% of women with endometriosis have some degree of infertility. The good news is with modern surgical techniques and modern treatment techniques, you're able to allow most of those women to have children. You're able to find a way or a method to get that to happen.
All right. For those watching tonight, and also ladies in that age group, what kind of tests do you do that will diagnose endometriosis?
Well, first thing is going to your physician for your routine checkup and make sure that you relay your complaints. Make sure that he understands that you're having a problem. And then endometriosis may be suspected based on pelvic exam and even ultrasound. If they see a cyst or feel a cyst, there may be a condition known as an endometrioma where you have cystic formation from the endometriosis. The only test that really can absolutely diagnose endometriosis is a diagnostic laparoscopy, where you actually take a lighted scope and usually go in through a portal site at the umbilicus and are able to view the pelvic organs and view the endometriosis, and even sometimes treat it at that time with electrocautery technique.
All right. Now, you spoke about treatments, but what treatments are available to the public?
Well, as most women are complaining of pain, the many things is you want to address the treatment of the endometriosis, treat the pain, either with anti-inflammatory medications. It's the most common treatment for the pain technique. Sometimes even narcotics are necessary. Then you want to treat it medically or even surgically. Medically, we have several different categories of medicine available. The most common treatment that's been around for years is just treating it with plain birth control pills. Cyclical birth control pills will help relieve the symptoms, help make the periods lighter and shorter and less painful. And that's many women's goal, especially in the younger reproductive age group. In recent years, we started using birth control pills long-acting, where basically a woman may go even 4 to 6 months without having a period by taking continuous birth control pills. And there are even certain types of pills that are marketed and designed for this, even though most pills can be used for that. There are other medical treatments, and the goal of all the medical treatments is to try to suppress the production of estrogen, which stimulates the endometriosis. Danazol is one of the oldest ones out. It's kind of frowned upon by many this day and age because it has a lot of male-type characteristics, facial hair, a lot of acne problems, so most women kind of tend to shy away from that. The GnRH agonists that we call, such as Depo-Lupron, which is actually used in men to treat prostate cancer, it's used to treat endometriosis, works extremely well by causing menopause. There's also even some of these newer medications that are used to treat breast cancer, the aromatase inhibitors such as Arimidex that many women may be on for breast cancer can also be used as an experimental drug to treat severe endometriosis, and it's worked quite well.
All right. Well, Dr. John Floyd, we appreciate you coming on. Very informative tonight. And I know for more information, they can call Terrebonne General at any time to get more information.
Certainly, they'll be happy to help. And thank you so much for having me tonight, Martin.
Anytime. Good seeing you again. We'll see you in short order. Once again, Dr. John Floyd. We'll take a break. When we come back, Stan Gravois has all the sports here on Bayou Time, so don't go away.